In this video, we'll talk about disseminated intravascular coagulation. It is a combination of both coagulopathies and the platelet abnormalities. So here we'll see the thrombosis. That means there will be unwanted clot formation, excessive unwanted clot formation, and also hemorrhage, bleeding. So this overaction of the coagulative pathway leads to the consumption of platelets and clotting factors. That means these clotting factors and platelets are utilized in the excessive unwanted clot formation. So once these are utilized, there will be deficiency of it. So when the body actually need the clotting mechanisms to work and prevent the body to lose more blood, it won't work. So there will be uncontrolled hemorrhage leading to the death. Etiology can be because of the sepsis, obstructive complications, neoplasms, tissue injuries, and syndromes. These are the major disorders associated with the DIC. Coming to pathogenesis. For this disease, it is divided into two parts. One is thrombosis, another is hemorrhage. This thrombosis is again caused because of two mechanisms. One is due to the excessive release of the tissue factor. Another is the widespread endothelial injury. So coming to the first factor, that is excessive release of the tissue factor. So this tissue factor is procoagulant. That means it activates coagulative pathway. So more the tissue factor, more the clot formation. It can lead to complications like excessive clot formation, consumption coagulopathy. In case of coagulation, the clot is formed with the help of platelets, fibrin, clotting factors deposition. In case of excessive clot formations, there will be excessive use of fibrin, platelets, clotting factors, etc. So once these are consumed, there will be deficiency of it. So this is the consumption coagulopathy, or it's also called as defibrillation syndrome. So the small thrombi or the small clots which are formed as a result of excessive tissue factor can also accumulate in the small blood vessels and causes the ischemic conditions there. And the ischemia leads to infraction, then it leads to the necrosis. So this occluded small blood vessels undergo ischemic necrosis. And in case of blood vessels which are coated with the thrombosis or the thrombotic layer, the RBCs, when they pass through this blood vessel, they change their shape, leading to anemia, microangiopathic hemolytic anemia. Coming to the second mechanism, that is due to the endothelial injury. When there is endothelial injury, there will be destruction to the endothelial lining, which exposes beneath layer, that is the subendothelial mass. So the subendothelium is thrombogenic. It attracts the platelets towards it. So once the platelets are attracted, they aggregate and form the clot. So that is how the thrombosis is formed. One is due to the excessive tissue factor, another is due to the endothelial injury. Coming to the second part of the pathogenesis, that is hemorrhage. Hemorrhage is caused due to the consumption coagulopathy because the platelets and every clotting factors is already utilized. There will be deficiency. When the body needs it to work, it won't work because of the deficiency. The second mechanism is plasmin activation. Plasmin has the anti-platelet or the anti-coagulative effect. It breaks the fibrin or the fibrinogen into the fibrin degradation products. Fibrinolytic is nothing but the breakdown of the fibrin. It prevents the clot formation. It also leads to the hemorrhage. Clinical features are bleeding, ecchymosis, petechiae, and microvascular thrombi can accumulate in the blood vessels, leading to the hypoxia, infraction, severe cases, multi-organ failure. Lab diagnosis: APTT, prothrombin time, bleeding time is increased, fibrinogen, platelet count are decreased. Peripheral smear shows the anemia, that too microangiopathic hemolytic anemia with cystocytes. Latex agglutination test is done to measure the fibrin degradation products. D-dimer test is a diagnostic test for DIC. Treatment: treat the underlying cause first and then replace the clotting factors and platelets if needed.